Okay, so hi, Professor Campbell. This is Joy Mandy. So for today's session, I will be interviewing or having a session with Buzz. He is an ongoing session, so it's not fresh. I estimate he might be even maybe between 5 and 8 sessions in. Seeing a lot of great progress with his therapy concerning his opioid addiction and his alcoholism. And we are in a place where he is now sober and making great choices. He's a part of AA as a support group and finding his way of discovering parts of his life. In this session, we're going to tackle existentialist thought with death anxiety. So I plan to explore with him his possibility of connecting with other people, also finding wisdom in his life and having a fulfilling life in itself. And so that's the goal of today's session. All right, so Buzz, how are you doing today?
I'm doing okay, trying to make it. The program is really beginning to make some leeway in my life. And since I met you and you introduced me to the program, I think I'm beginning to see some changes. But there's still some struggles here and there because I've been addicted for about 13 years. And I started off with alcohol, and the alcohol wasn't doing it for me. So I felt that I needed another sedative or something else. And that's when I got hooked onto opioids and then the alcohol and the opioids and the alcohol. So.
That's great. Well, I'm happy to hear that you're making some leeway. How's it? Because I know last time we met, we had the whole discussion about you having a sponsor in the AA and in the Narcotics Anonymous as well. So how's that working out for you? Having that sponsor kind of walk with you right now.
Well, I'm getting some help, and I think it's more of me not really ready to engage completely with the AA and
Okay.
with the other programs. But when you've been an addict for so long, with the alcohol and with the opioids, and so it's a struggle and it's a challenge. But I don't want to. A lot of people say we take it one day at a time, but I want to take big steps because there's things I want to do with my life, and I don't want to have a reset. So.
If you remember from our last session, we kind of talked about that, like we touched on, the day at the time concept, because, you are a man of achievement. So just remembering that we don't have to achieve everything at once. There's something that you kind of mentioned that I really wanted us to touch on today, where you said you're having, you don't feel ready to connect. Do you think at all that could do with your anxiety with death at all? Why you feel like you're afraid to connect with the other people in the group?
I would say that would be the main reason, because you're the only person that I felt that I could connect with, because my addiction or addictions, and it was just how you presented yourself to me as a counselor and what you do. And so I would say that me being at near death multiple times, with the opioid and, almost having, liver failure, kidney failure due to the alcoholism. And I just want to see some changes, but I want to commit, but I really don't know how to commit.
Okay.
Because I still feel that when this depression comes upon me because of the opioid, it has that kind of side effect. And, I find myself, wanting to kind of just dip, just a little bit, into the back to kind of you release some tension and some stress that I'm dealing with.
Okay. So then let me ask you this. What exactly, like when you took the opioids and we haven't touched on this since probably like our second session, but I feel like it's a good time to kind of come back to it. But when you used to use the opioid and you used to drink, what feelings did that give you? Like, granted, of course, we've already gone over your history, like your medical history and things like that, which is what brought you into the therapy in general. But what feelings did they give you? Did they make you feel alive? Did they make you feel more connected? Was it easier did you have less anxiety with meeting people? Like, when it comes to your social life, what did those things do for you?
Well, let's deal with the alcohol first, because my dad was an alcoholic, and I think I was, chemical dependent with that from him. So I started off with alcohol probably at the age of 15 years old, and then I, just continued to get into it. And to me, it was not more or less saying to heal my pain, but it made me feel happy. made me feel happy and made me feel excited, and I always wanted to communicate with people. It was like a sense of me getting out away from the normal formality of things. So drinking was not just an addiction, it was an enjoyment for me. But when the drinking became toxic, I needed a balance. So then that's when I was introduced to opioids.
Okay.
And when I got on the opioids, it was like, you know, the drinking had me excited, but the opioid had made me high and kind of balanced out that alcohol. So I was high for a long period of time, you know, and it was like a stimulant to me. And that's why I really indulged in it for all those years.
Okay. So then, right now in your life, what are some activities that you do? What are activities, more so, what activities do you enjoy doing? Like if there's any, and that could, and let's just be imaginative, like if there's anything that you've always wanted to do, like maybe, I know you said you used to go to the gym. Is that something you would like to re-implement in your life? Is there, you know, like, do you like drinking tea? Do you enjoy coffee? Like what type of things do you enjoy doing?
Well, actually, I met with a pastor, and he was a former AA, a counselor, and you know, I've been, you know, visiting with him, you know, when I'm not having sessions with you, and it's kind of changing even my faith, because I had kind of pulled away from the church, and I'm church orientated, but it kind of made me, you know, pull away from the church, because the church I belonged to, they were dogmatic, and, you know, they condemned me instead of trying to offer some kind of resolution or treatment for me. So it actually intensified my addictions. But this pastor is different, you know, and I pretty much didn't like female pastors, but she's a woman pastor, and, you know, I embraced some of the things she said, and it kind of triggered, you know, some of the old ways I used to, you know, when I was really coming up in church. And so I think now that the thing that's balancing me, you mentioned about the weight room. You know, I was really into the weights, but, you know, I thought that would be something I could get into, or, you know, kind of even, you know, think about it in the near future. But I just want to get this thing off of me. So the, you know, the weightlifting, you know, is something, as I stated, that I'm going to get into in the near future. But right now, you know, I want to combat these things that are internal within me that have been laying dormant for so long. And I think most of it came about, you know, through a broken relationship. And, you know, that caused the drinking, and then that caused the opioid addiction, the drug addiction. And, you know, like I said, since I met this female pastor, she's just a wonderful lady, and she's been speaking some positive things into me. So along with me coming to your meetings and, you know, visiting the church, you know, it's kind of balancing me out, and I see my life beginning to turn in a complete different direction, and desires are kind of leaving me, you know, but I still have those desires, and I still have sweats at night because of the opioid addiction, and I don't want any of that any longer.
Okay. One thing that I will say is I'm extremely happy that you found a church home, because I know that that's a part of your life that you really did disconnect from, that you found comfort in. And so something that we touched on the first time, you know, we did our interviewing and things like that, is how important it is to find community. Because anytime you're going through addiction and you're going through your journey of healing and things like that, it really makes a difference when you have support and when you don't have family support, just to have somebody to back you. So I'm really pleased to hear that, you know, with even out of being a homework assignment, you managed to find a church home that could really walk this journey with you. And she sounds phenomenal, your new pastor. So within this new community, how do you plan on connecting with them a little deeper? Like, other than the pastor, are there like other people there that you feel that you can befriend or start spending time with, that you feel that they make you feel safe to share?
Okay. That is great that you mentioned that. Actually, the pastor's son, he had an addiction to crack cocaine, and he shared with me his testimony and how long it took him to recover. And so in that instance, it was kind of shedding light on what I'm dealing with, and kind of brought a little balance to me. And you know, we exchanged numbers, and You know, we've already been out probably on 3 other occasions. You know, we went
Okay.
bowling, and you know, we went out to grab a little bite to eat, and
Yeah.
you know, we're beginning to share. And so I think I'm beginning to open up more, mainly because the connection that I shared with you. So you were the light at the end of the tunnel. You know, it's the way you presented what you do. You know, your clinical science. It's the way you presented it to me that allowed me to embrace it, because I had been to other AA meetings and I dealt with other people, but I didn't receive the information. You are very credible, very knowledgeable in how you put it, and that's what attracted me to listening to you. And I don't too much give an ear to everybody, but because of the way you presented it to me is the reason why I think I'm being changed.
Well, that's awesome. And I really appreciate your belief in my credibility and everything like that. But I always want to attribute again that you're doing the one doing the work. I'm literally just here to just go along with you in the process. So today, like, our session is wrapping up. So what I do want to give you is a little bit of homework tonight and over, because I think I see you again in about 4 days. So throughout the 4 days, and especially tonight, I want you to think of a few ways where you can begin to have more of a fulfilling life. Now that
Okay.
you have these brand new connections and you're making a new friend, really, I want you to think about how you can make yourself more fulfilled based off these new connections, because it's amazing. Like, that's
Yes.
great. So I will see you. Sandy will
Yes.
see you outside.
And I have one other thing to share with you, if I
Oh,
can.
yes.
Because of the connection, I have found myself with money now. And I have a bank account, and I'm excited about that. You know, because of the opioid addiction and the alcohol addiction I had. All my money was going there, and I got my apartment back. So I'm excited about that, and I'm looking for our next
Those
session.
are great. That's awesome. I'm
Yes.
so happy to hear
Yes.
that, because I know there's those were some real goals for you, and I think it's amazing that you're really rebuilding your life.
Yes.
And a lot of people don't always make it to that step, but I think it's phenomenal, especially with the progress you've been making. I think that's great. So yes, for the next session,
Okay.
that's your homework. I'm excited to hear what you
Okay.
have new, because we've been doing great, and so I'm looking to hear better results the next time I see you. Okay.
Yes, thank you.
Awesome.
Thank you.